name's Sean,
And my name's Sarah.
and we're both medical students at the Alabama College of Osteopathic Medicine. So today, Sarah and I and some of our other colleagues are going to be talking about stroke and some of the things that you want to be looking out for. So first, what is a stroke? A stroke is basically a problem with getting blood to your brain, and there's usually two ways that this occurs. One is if there's a clot or something blocking your blood vessel, and the second is if the blood vessel ruptures, causing a brain bleed.
So signs and symptoms, it's important to know these in order to better spot a stroke. They might present differently in different patients. So you might experience weakness, any changes in vision, headaches, any trouble with balance, facial drooping or numbness, slurred speech, or trouble getting words out, confusion, or nausea. This is an easy way to remember how to properly spot a stroke. Think FAST. F is for face, for facial drooping. A is for arms, for arm weakness. You can also have leg weakness. S is for speech, difficulty speaking. And T is for time. If you're experiencing these symptoms, it's important to call 911. You may have heard the saying, time equals brain. That is because the sooner you get to the hospital, the more options of treatment you have. After you have completed the CT and your physician determines that there is a brain clot, there are two different options of treatment. If you arrive within 4.5 hours of symptom onset, you might be eligible for a clot buster medication. This is known as TPA. It will break the clot. If you arrive at the hospital within 6 to 24 hours of symptom onset, you might be eligible for a procedure known as a thrombectomy. The thrombectomy will allow the physician to go in and remove the clot through a surgical procedure. Both of these treatments help restore blood flow to the brain and help prevent lasting damage. It is important that as soon as you notice signs and symptoms of a stroke, to seek care immediately.
So some of you have heard of something called a mini stroke. It's called a transient ischemic attack, but basically it's if you have some of those symptoms that Sarah mentioned that last less than 1 hour and they resolve on their own. One of the things that you want to do is if you see this happening, you want to go and follow up at a hospital immediately because you may need a further stroke workup.
Here are some of the risk factors for a stroke. High blood pressure, if you're over the age of 65, if you use tobacco or you have used tobacco in the past, heavy alcohol use, a family history, high cholesterol, obesity, sleep apnea, cardiovascular disease, and diabetes. These are only a few of the risk factors, but these are probably the most important to consider if you're trying to understand your stroke risk.
Hi, I'm Jocelyn,
My name is Noah.
and today we're going to be discussing with you some things that you can expect after you've had a stroke. Once you're at the hospital, you can expect your doctor to need various types of imaging to get a better idea of not only what type of stroke you've had, but also how severe the stroke is and the medical interventions necessary depending on these factors. So let's briefly go over a few now. The first thing your doctor will most likely want to order for you if they suspect you've had a stroke is a CT scan, and this is to rule out a brain bleed. If no brain bleed exists though, further imaging may be necessary to assess how severe the stroke is to help guide future management and prevention for future strokes.
And now we'll discuss stroke prevention. Certainly, smoking cessation and alcohol cessation can decrease your risk of having a stroke in the future. Also, regular visits with your primary care physician, where you might discuss blood pressure management, diabetes management, lowering your cholesterol, and also possibly getting a cardiac workup where you might be started on blood thinners if indicated. Lastly, it's important to remember that exercise 3 to 4 times a week for 30 minutes a day can sometimes help decrease your risk of having a stroke, as long as it's recommended safe by your doctor.
In addition to ways one can prevent strokes, it's also important to go over what you can expect after you've had a stroke. Strokes can be overwhelming and a life-altering event, so here are some of the interventions you may need to undertake. First off, physical therapy, which is intended to help regain any movement and function. Occupational therapy, which helps patients relearn skills needed to perform activities of daily living and also make any modifications to the home that may be necessary. Speech therapy, which can help when a stroke results in difficulties forming words or understanding someone else when they're speaking. And mental health counseling. It's common for people to experience depression, anxiety, and other mood changes after a stroke. Therapy, sometimes along with medication, can help ease some of these symptoms.
And a common question that most people have is, will I make a full recovery? And it's important to remember some of the factors to consider for your recovery. Like, where did the stroke occur? How big was the stroke? Age is also an important risk factor, as well as other medical conditions. And finally, how soon you started treatment after the stroke began. The brain is capable of adapting and recovering, and it's really important to remember that with patience, time, and working with your rehab team, it is possible for you to make a full recovery.
We hope this clarifies any questions you may have had about strokes, and even helps you to spot a stroke in case you encounter one. If you have any more questions, please visit www.stroke.org or contact your primary care